Hello everyone, here is Bachir Almoghrabi, a medical student. We are going to discuss together some important points about genetically transmitted hypercholesteremia and diabetes. So, what is hypercholesteremia? Familial hypercholesteremia is an inherited condition characterized by very high levels of cholesterol in the blood. Cholesterol is a waxy, fat-like substance that is produced in the body and obtained from foods that comes from animal, particularly eggs, yolks, or meat, or powdery fish, and any dietary products. So the body needs this substance to build cell membranes, make certain hormone, and produce compounds that aid in fat digestion. So in people with familial hypercholesteremia, the body is unable to get rid of extra cholesterol and it builds it in the blood or in the blood vessels, I mean. Too much cholesterol increases a person's risk of developing heart disease. So people with familial hypercholesteremia have a high risk of developing a form of heart disease called coronary artery disease. This condition occurs when excess cholesterol in the bloodstream is deposited on the inner walls of the blood vessels, particularly the arteries that supply blood to the heart, named coronary arteries. The abnormal buildup of cholesterol forms clumps or plaques that narrow and harden artery walls. As the plaques get bigger, they can clog the arteries and restrict the flow of blood to the heart. The buildup of plaques in coronary arteries cause a form of chest pain called angina and greatly increase a person's risk of having a heart attack. As we see here in the picture, the cholesterol build up in the inner walls of the arteries. So, familial hypercholesteremia can also cause health problems related to the buildup of excess cholesterol in tissues other than the heart and blood vessels. If cholesterol accumulates in the tissues that attach muscle to bones or tendons, it causes characteristic growths called Tandonxanthoma. So these growths most often affect the Achilles tendons, which attach the calf muscles to the heels, and tendons in the hand and fingers. So yellowish cholesterol deposits can develop under the skin of the eyelids and are known as xanthelasma. Cholesterol can also accumulate at the edges of the clear front surface of the eye, the cornea, leading to a gray colored ring called an arcus cornealis. And here we can see together in the picture the signs of familial hypercholesteremia. So it's high level of LDL cholesterol, uh, familial history of this disease, swollen or painful tendons, as we just talked about tendon xanthomas, and bumps around the knuckles, elbows, or knees. So familial hypercholesteremia resulting from mutation in the LDLR, APOB, or PCSK9 gene have an autosomal dominant pattern of inheritance. Autosomal dominant inheritance means one copy of an alternated gene in each cell is sufficient to cause the disorder. So an affected person typically inherits one alternated copy of the gene from an affected parent and one normal copy of the gene from the other parent. So rarely a person with familial hypercholesteremia has a mutation in both copies of the LR and APOB or PCSK9 gene. This situation occurs when both parents have familial hypercholesterolemia and each passes one alternated copy of the gene. So the presence of two mutations results in a more severe form of familial hypercholesterolemia that usually appears in childhood even. So when familial hypercholesterolemia is caused by a mutation in the LDLRAP1 gene, this condition is inherited in an autosomal recessive pattern. What is autosomal recessive? Autosomal recessive inheritance means the condition results from two alternated copies of the gene in each cell. The parents of an individual with autosomal recessive hypercholesterolemia each carry one copy of the alternated gene, but their blood cholesterol levels are usually in the normal range. We can see here in this picture a small explanation about the genetic pathogenesis of familial hypercholesterolemia. So 69.7% it's caused by LDLR mutation, 5.7% the PCSK9 mutation, 1.4% for ARH, and 23%, which is a big percentage, unknown cause of familial hypercholesterolemia. And we can divide them here in two types of inheritance, as we just said, autosomal dominant and autosomal recessive. Here in the left of the picture, we can see how the acetyl CoA is transferred to CHOL to be transmitted in the bloodstream as VLDL, and the VLDL will be then transferred or transformed to LDL4. So, familial hypercholesterolemia is usually affects an estimated in 1 in 200 to 1 in 250 people in most countries. This was the result of last studies. I don't know if the number changed nowadays because we can see that the proportion of hypercholesterolemia is increasing in many countries. So this condition occurs even more frequently in certain populations, including Africans, South Africa, Lebanese, and Tunisians. We see here a small pedigree showing the way of having a grandmother affected with hypercholesterolemia and a grandfather healthy. The grandmother may transfer this disease to a daughter or a son, and this can be also transmitted by generations like we see here. So, familial hypercholesterolemia is characterized by impaired uptake of cholesterol in peripheral tissues, including the liver and the pancreas. In contrast, statins increase the cell cholesterol uptake and are associated with increased risk for type 2 diabetes mellitus. We hypothesized that transmembrane cholesterol transport is linked to the development of type 2 diabetes. In a cross-sectional analysis in the Netherlands, the prevalence of type 2 diabetes among patients with familial hypercholesterolemia was significantly lower than among unaffected relatives, with variability by mutation type. If this finding is confirmed in longitudinal analysis, it would raise the possibility of a causal relationship between LDL receptor-mediated transmembrane cholesterol transport and type 2 diabetes, which is not confirmed yet. So here we see the good diet. If you have a familial history of hypercholesterolemia, what should you eat? What is the good diet? Mainly, you have to avoid like we said, everything with dietary products or with high fat, like saturated fats and sugary food and beverage, and even alcohol. But you have to eat uh, fruits and vegetables, grains, nuts, fish, and sure low fat and dairy products. Let's continue with type 2 diabetes mellitus insulin resistant. So type 2 diabetes is a disorder characterized by abnormally high blood sugar levels. In this form of diabetes, the body stops using and making insulin properly. What is insulin? Insulin is a hormone produced in the pancreas that helps regulate blood sugar levels. Specifically, insulin controls how much glucose is passed from the blood into the cells, where it is used as an energy source. When blood sugar levels are high, such as after a meal, the pancreas releases insulin to move the excess glucose into cells, which reduces the amount of the glucose in the blood. And let's note here, and after the meal, when the body is using energy, the energy comes from releasing the glucose stored in the cells into the bloodstream to give energy. So, most people who develop type 2 diabetes first have insulin resistance, a condition in which the body's cells use insulin less efficiently than normal. As insulin resistance develops, more and more insulin is needed to keep blood sugar levels in the normal range. To keep up with the increasing need, insulin producing cells in the pancreas, called beta cells, make larger amounts of insulin. Over time, the beta cells become less able to respond to blood sugar changes, leading to an insulin shortage that prevents the body from reducing blood sugar level effectively. Most people have some insulin resistance as they age, but inadequate exercise and excessive weight gain make it worse, greatly increasing the likelihood of developing type 2 diabetes. As we see here, the pancreas will give the insulin in secrete insulin in the bloodstream that increase glucose in the bloodstream. Muscle will be unable to use glucose due to insulin resistance. Uh, what increase that, as we said, what may worsen the case is obesity and weight gain, but mainly it is a inherited factor that make the muscle unable to use the insulin. Type 2 diabetes can occur at any age, but it most commonly begins in middle age or later. Signs and symptoms develop slowly over years. They include frequent urination, that we call polyuria, excessive thirst, polydipsia, fatigue, blurred vision, thin light, or loss of feeling in the hands and feet, diabetic neuropathy, it is surely a complication, sores that do not heal well, and weight loss. If blood sugar levels are not controlled through medication or diet, type 2 diabetes can cause long-lasting chronic health problems including heart disease and stroke, nerve damage, and damage to the kidneys, eyes, and other parts of the body. Type 2 diabetes does not have a clear pattern of inheritance, although many affected individuals have at least one close family member such as a parent or sibling with this disease. The risk of developing type 2 diabetes increases with the number of affected family members. The increased risk is likely due in part to shared genetic factor, but it is also related to lifestyle influence that are shared by members of a family. So, genetic testing for type 2 diabetes. We usually do tests for diagnosing gene mutations associated with type 2 diabetes. The increased risk for any given mutation is small, however. Other factors are far more accurate predictors of whether you will develop type 2 diabetes or not, including BMI or the body mass index, the familial history, as we said, at least a patient who have diabetes mellitus type 2 at least have one family member with the same disease. High triglyceride and cholesterol level, we just talked about hypercholesterolemia. A history of gestational diabetes. Research trusted sources shows that type 2 diabetes occurs more frequently in Hispanic, African, American and Asian American people compared with other ethnic groups. This may be due to health inequalities that are prevalent in marginalized communities. Here we can see in this table the different types of diabetes. Let's discuss the genes related diabetes. The diabetes type 1 is polygenic. It can be treated by insulin injections. The diabetes type 2 is also polygenic. It has to be treated by lifestyle change and may have oral agents and insulin. MODY1 and MODY3 are due to mutation in HNF4A and HNF1A. It has to be treated by low dose of sulfonylurea pills. The MODY2 type is due to modification in the CGK gene, no treatment needed in this case. And the neonatal diabetes, it's due to mutation in the genes KCNJ11 and ABCC8. It has to be treated by high dose of sulfonylurea pills. We note that metformin is usually tried first, but not everyone responds to it. That's why usually the first treatment given is metformin, and we see the So, types for diabetes prevention. The interaction between genetics and the environment make it difficult to identify a definite cause of type 2 diabetes. However, that doesn't mean you can reduce your risk through modifying your habits. The diabetes intervention ancestry diet and inheriting metabolism study, a large 2020 randomized clinical trial. Trusted source of people with type 2 diabetes suggests that weight loss and increased physical activity can prevent or reverse early type 2 diabetes. Blood glucose levels return to normal levels in some cases, and most participants experienced diabetes remission. Other reviews of multiple studies have reported similar results. Here are some things you can start doing today to reduce your risk for type 2 diabetes. Start an exercise program. So slowly add physical activity into your daily routine if you can. For example, take the stairs instead of the elevator, or park further away from building entrance. You can also try going for a walk during lunch. Once you're ready, you can start adding lightweight training and other cardiovascular activities to your routine. Aim for 30 minutes of exercise each day. Talk with your doctor before starting an exercise routine. They can help you create a plan that complements your needs and abilities so you can safely exercise and take advantage of its health benefits. 2. Create a balanced meal. Cooking your own meals is the easiest way to make nutrient dense choices. Come up with a weekly meal plan that includes dishes for every meal. Stock up on all of the groceries you'll need and do some of the prep work ahead of time. You can ease yourself into it too. Start by planning your lunches for the week. Once you're comfortable with that, you can plan out additional meals. 3. Choose nutrient dense snacks. Stock up on snacks options so you can keep your body uh, full of energy level high. Here are some balanced, easy to eat snacks you can or you may try. Carrot sticks and hummus, apples, clementines, other fruits, a handful of nuts. Thought be careful to keep an eye on serving size. Air popped popcorn, but skip adding lots of salt or butter. Whole grain crackers and cheese. And here we finish our presentation about the two most common inherited diseases, hypercholesterolemia and diabetes mellitus type 2. Thank you for watching.